Thank you so much, the one and the only Manisha Koirala ji, for joining me today.
Pleasure, doctor.
we're having this endless narrative around us about how cancer cases are on the rise. But sadly, the awareness about the symptoms, the diagnostics, the treatments, and also a normal life after cancer, sadly, that knowledge is very, very little. And I think we need to normalize this conversation around cancer. So I'm really grateful to you today for coming on to have this little conversation where we are going to talk about two or three pertinent points about cancer. So, first of all, congratulations, 10 year down and going strong, and God bless you always. Okay.
Thank you.
So, there is so much lack of awareness about how a cancer presents. So, I want you to talk us through your symptoms and how it led to diagnosis, and also touch a little bit about why it is important for us to be self-aware about changes in our body.
Right. So, doctor, as everybody else, even in my family, even though we've had a couple of cancer deaths, and but nobody really had a link that there could be anything genetic or there could be anything, And I was leading a life. Walloped in its own highs and lows of life, and full swing at it, full drama at it.
Yeah.
So and I just had no clue when the symptoms started creeping in. I just had absolutely no clue, so I kept on fighting the symptoms, because uh, I started bloating, and I thought, oh my god, I'm putting weight on my stomach. So I started vigorously doing Pilates. I started doing running. I started doing all sorts of things. And then I was getting exhausted. I remember I would work out for 3 hours and come home like I would be flat out, And I've never been that exhausted in my life, no matter how, because I'm a sports person. I used to play basketball and all that. So uh, have been physically exhausted, but never felt that I was so badly exhausted. Then I was urinating quite often because of an ovarian cancer. That also, it just, I did not pay attention to. And then I would get cough and cold. I had this flu which would last me for more than 2 weeks. And normally, flu for me was 3, 4 days, at the max 5 days. It would leave. Here it was like for 10 days it's still there, and I had all these weird system which I had no clue that anything serious was happening inside my body, because these symptoms are so everyday symptoms. When cancer happens, you don't know that, you get these small little symptoms, but in a stretched period of time.
That's very
And
important, and I'll elucidate that a little bit more later. So please go on. Yeah.
yeah, so all this was happening, and my stomach did not stop bloating. It just grew so big. I was in Nepal, and my aunt is a gynecologist. She's one of the top gynecologists in Nepal. And she checked me and she said, are you pregnant? I said, no, Kaki, I don't have anybody in my life at this point of time, and blah blah blah, whatever, and it's not, you know um not the case. So she said, very strange. This is like, then I it started pricking me. My stomach was, like, it started hurting me so bad. I got myself trekked into the hospital. Then they insisted I take like a CT scan. And in the CT scan, it was shown that I had developed third stage of ovarian cancer. And that was that. And after, in Nepal, everybody was a family member, all the doctors and everybody, and they just kind of rushed me out to Mumbai. And Mumbai, I came again, did a second set of CT scan and all the checkups and everything. And there also it was diagnosed at late stage of ovarian cancer, third stage. All that, this time just flew so fast. Then we landed up in New York. In New York also, getting the right doctor appointment and blah blah blah, the whole shebang happened. And finally the operation happened. And during operation only I realized, when after the operation, it was said to me that it was not third, but it was fourth stage of cancer, because it had touched my diaphragm as well. So that was that. And then, of course, during my chemotherapy, my cancer marker was coming down. I was responding really well to chemo by the grace of God. And somehow we also did testing for genetic testing, and I figured that I am BRCA positive. And a year back, my bua had got 0 stage of breast cancer. And when she heard mine, and she immediately did her genetic testing, and she was also BRCA positive. And then after that, I started telling all my cousins, whoever the Koirala daughters are, that probably it's there in all of us. So what all we need to do and figuring out. So, Doc, the thing is, what I have found, and you probably know better, is that what I know, that somehow the people tend to be very scared to get the genetic testing done. So, and
the whole reason for this conversation with you, and I think India needs an Angelina Jolie, and you could be the Angelina Jolie who raises awareness about the importance of family history. Now the thing is that only about 5 to 10, maybe up to a maximum of 15% of cancers are associated with a strong family history risk. Most cancers happen in those who do not have a family history. So that myth is out there that if I don't have a family history, I'm okay, which is a big myth, because it commonly happens to those who don't have a family history. But the sad story here is that those who do have a family history, even in this day and age, like you said, are unaware that there are tests that are available out there which allow you to detect whether you have the faulty gene. Now, say if your faulty gene was detected prior to you having, developed the cancer, then things can be different, because there are facilities available now for us to do what is called risk reduction. And this is the only definitive risk reduction in the cancer world. Like, if there is a BRCA positive gene which increases the risk of breast and ovarian cancer, then it is important for you to go and have that screening done. And as you said, you spread the message amongst your cousins, because a lot of our patients do not want to tell their family. And I think that message is important, right?
Absolutely, Doc. You said the right thing, that if we know that we are genetically dispositioned to get a cancer in future, why not to get it tested and be extremely agile? Because my bua, who was detected 0 stage of cancer, she did not go through chemotherapy. Yes. She just went through the surgery and nothing was spread, and it was a smooth way out for her. Because she lives in America, and there is this whole system that they do checking every month or every date. They're very vigilant about physical examination. So if you catch cancer early, it's 100% curable, and it's treatable, and it's it's lesser expenses for the patient, lesser death threats and trauma threats and all that.
Yeah, so like I was saying, so if you were aware that like you were BRCA positive, like your bua was lucky to be caught in stage 0. So if she was aware,
Exactly.
and if a risk reducing surgery or more frequent monitoring, so these are the two main things that can be done. So like a BRCA positive patient is advised to remove ovaries and breasts before cancer develops in them. Now, for a woman to be told that you have to have your breasts removed when there is no problem, it is actually a very big psychological issues. What is your take on that?
Doc, I haven't removed my, though I'm BRCA positive,
Positive.
I do not wish to remove it. I am diligent about doing a screening done. I am I'm also diligent about my lifestyle, because what I have done little bit of readings, and not like you doctors, but my in my own way, little bit of research that I realized that even if I have a genetic disposition, it doesn't mean 100% I'll get the cancer. What it means is that I am more likely to get one. And also, what happens is, whatever understanding I have is, the cell's environment matters a lot.
Yes.
If it's in a healthy environment, I could probably keep the cancer at bay. If and if it's my immunity is strong, my environment, my cells environment are strong, which is related to my lifestyle, all that. So I'm actually navigating a way where I don't have to do a surgery, but I'm very agile with my screenings, very agile with my lifestyle habits, very like a hawk. I am living a life which benefits me which benefits me
In more ways than
overall.
one. Yeah, yeah. So I think you put it very correctly, because a lot of fear with getting this testing done is that patients feel that then the doctor is going to tell them that the only way out is to remove your breasts, remove your ovaries, and have risk reduction surgery. But that is not true. So yes, ideal would be to do risk reducing surgeries, because that definitely reduces a lifetime risk of say 80% of making cancer to less than 5%. It doesn't make it zero. Everybody with the gene will not get the disease, but the risk is significantly higher than the normal population. So you mentioned two or three points, just very aptly, and I want to kind of highlight them. That first of all, that if there is a family history, that normalizing the conversation about it amongst your cousins, amongst your relatives is very important. If you find out that you have a gene that is positive, please don't hide that information. You could benefit your family members from knowing in time. Secondly, once you know you are gene positive, you have two or three definite options available. The most definitive proven being surgery. Yes, if you are not keen for surgery, then it is imperative that you are, as you said, like a hawk. You are getting your routine screenings done. Now, doing the screening does not take away the risk of making a cancer. It just ensures
Hmm.
that, God forbid, if a cancer is made, it is detected in time. And as you correctly pointed out, cancer that is detected in time is curable. It's only the unlucky few who won't do well, most will. So I think that's very, very important to reinforce that. I also want to let everyone know that these kind of testings are now routinely available in most parts of the world. Definitely in India there are, but a word of caution: if you hear your family members had cancer, please don't walk yourself into a lab and give your blood test to get this done. This should be done after discussion with a genetic counselor. You should understand what you want to do. Say a gene test comes back positive, and sometimes they come back as not being positive or negative, but something abnormal, which is called variation of unknown significance. So that discussion really needs to be had. And I'm really glad you brought all these points out, because we rarely ever talk about BRCA genes and family history, risk of cancer, and what we should be doing about that. So thank you for that. Now, the other
Welcome.
the other little issue that I really want to discuss with you, sitting in clinic, I spoke to you about the symptoms, and you correctly mentioned that you kept thinking it was something else. And I'm a breast cancer surgeon. I sit in clinic. Every day I see at least one woman who says, I had a lump in my breast. It did not hurt. So I thought it was nothing. And she comes to clinic 1 year, 1.5 year down the line, by which time the cancer has spread. So it's important for us all to know that, like in Bollywood movies, they show very dramatic things about what happens when you have cancer. Khoon ki ulti aayegi, tumhara wazan kam ho jayega. In most cancers, that doesn't happen. And in early stage cancer, that is not true. So please be aware of any changes in your body. And if any change doesn't settle within what we say, thumb rule of 2 weeks, maximum 3 weeks, please get a specialist to see you. Always best to go and see an oncologist, because for us, everything is cancer unless proven otherwise, and we'll see it with a high degree of suspicion. So it's very important to be aware about symptoms. Now, once you were diagnosed, Manisha ji, another thing we see in clinic is that I keep getting, before the patient walks in, I get a chit from the relative saying, when she comes in your room, don't use the word cancer. Don't tell her she has cancer. And I tell everybody that there's nothing worse than that, because to not know, it
Yeah,
increases the
yeah.
fear around it. So tell me, what are your thoughts on and how important do you think it is for a patient to know she has cancer and to be involved in decision making?
I feel it's very, very, very important to be honest, and it's to face it head on, because we don't have a choice but to face it head on.
Yes.
And to basically, when you're lying to somebody, you're just taking away that particular thing. But I also had a dear friend of mine whose mother was 80-year-old plus, I think 85 plus, and she got cancer, and he didn't want to tell her. So I understand that, later on in age, when there's not much scope for living and the quality of life is going to be deteriorating and all that. So in those circumstances, I understand. But if it's somebody who can deal with it, somebody who has hope that the treatment is going to help survive longer and all that, I feel you need to be honest.
Yes. See, because
So
culturally,
that
yeah, we try to shield our family members, which in a way I think, because I see the fear in the eyes of the lady who has not had a chance to discuss this about her treatment options, about knowing which way the treatments will go. So I understand when you say about somebody who is very old later in life, you don't want to distress them by using maybe the word cancer. And that is why, again, I will say that we need to normalize this conversation, around
yeah,
cancer.
yeah,
But
yeah.
but definitely, I'm sure the fact that you knew and you were part of decision making, initially, I'm sure it overwhelms. But then to be able to talk to doctors about it, did that help take away a little bit of the fear that the word cancer comes with?
Absolutely. I mean, I was constantly navigating, talking to doctors, talking, my own doctors, my oncologists, like 100 question. I would go with a diary and a pen. I would diligently look on the net who's come out of this kind of a cancer. So I was involved, very much involved in how my life is going to be ahead. So taking that away is unfair, I feel, because a person who has the cancer actually knows exactly what that person is going through. So please inform them, please make them part of the whole process. And it's like the doctors, the family members, the patient, everybody should be in one team. It's everybody is it's a teamwork.
It is teamwork.
It's
Yes. I tell
so
everyone, the fear of the unknown. If you don't know your enemy, it's very unlikely that you're going to win a battle. So the more you know, the more it empowers you. And I
absolutely
and we are scared of feeling scared. Is that true?
right.
I think
Absolutely.
we need to normalize it's okay to feel scared. It's okay to cry. When my patients are trying to be
Absolutely.
strong, when I break the bad news, I tell them cry. cry it out, because once you do that, then you can take that next step forward. In fact, I have this joke in my clinic कि मेरी शक्ल इतनी बुरी है, जो कमरे में आता है मुझे देख के रोना शुरू हो जाता है. But I think those tears are so important, because you know, expressing your emotions when you are a cancer patient is really, really important. And I think, when people like you, throughout your journey of cancer, you kept posting about how you were dealing with the chemotherapy side effects. I'm sure that was also a way of strengthening yourself, isn't it?
I mean, it was totally a catharsis. It was, sharing my joys and pain and my struggle really did help me. I started getting so many good advices from unknown people, even, so I was filled with a lot of good information. Of course, I mean, I had to filter out a lot of wrong gyans also.
Yeah.
But I felt opening up helped me tremendously, emotionally, mentally. It did help a lot.
So that opening up for cancer patients culturally, especially for Indian women, who sadly sometimes in a clinic are sitting at the back of the room, and so many relatives and friends are trying to have a conversation with the doctor, but the patient, you know, is not the center of it. So I think that is very important, to deal with the emotions, to understand what cancer is, to understand what treatments are going to do to you. So I think that's really important. And when there are so many horror stories of cancer out there, but when we see, positive stories of people like yourself, I know it brings so much hope, to patients who are undergoing treatments. And like you said, when you were undergoing treatments, you were looking for that beacon. And it's nice that now you are that
Absolutely.
beacon for other patients, isn't it? So,
Absolutely. I promised myself, Dr. Kaur, I was really hunting down on the internet, trying to see if somebody had spoken, and not a lot of people they had spoken. And
hmm,
that's when I took a decision that if I get well, I'll be speaking it out at any given chances and giving hope. Because I think hope plays a major part in our
absolutely.
life.
And it's funny you said that, because I was going to wind up this conversation with the importance of hope in treatments. In my clinic there is a saying which says, faith sees the invisible, believes the impossible, and receives the incredible. And I think it is so important for that faith. I don't know if you can see my little corner of gods in my clinic, which patients have over time collected, because they drive or they derive their strength from it. So I really want you to tell us about the power of hope and faith. I know what my medicine is going to do. But if I have learned one thing sitting in my clinic, is the power of the mind over the body. So please talk us through how you got that hope and how important it is for a cancer patient to latch on to it.
Absolutely. I feel, first of all, I mean, डूबते को तिनके का सहारा कहते नहीं. So
Yeah.
I had the same sort of a thing. I was latching on to any remote hope also. If I get, I will just focus only on that. So I was hell bent on not dwelling in my sorrows and pain. And yes, there were days where I would think, okay, this is the end of the life, and blah blah blah, all that. But those days in comparison was very small amount of time. Mostly I was just, my mind was into that hope. And I feel that really plays a strong role in our life. uh, Mind, body, spirit, as we know, is all interconnected, intertwined. Everything kind of impacts the other. So no matter how tough. I remember one nurse who was giving me chemo, and I was having a terrible, terrible, terrible time. And so she kind of told me, she said, "I know it's tough, but you are tougher than that."
Yeah.
And that has stayed with me. That has really stayed with me. And I mean, small little things, just giving hope, knowing somebody else has survived, knowing the other person is also going through the same thing, but is willing to, get up and do the normal chores.
Yeah.
Like, I was encouraged to go for walks, no matter how much difficulty it was. I literally could not get out of my bed, but my dad, who was like really slim and tiny, and would help me walk, take one step at a time, another step, another step, another step. And I mean, like that, my mother, who are, my parents are older, but they really encouraged. So I felt, you know small, small, small things also positively doing towards the betterment of your well-being. No matter how bad the chemo symptoms were, I was taking a very strong chemo.
Yeah.
I was bombarded with a strong chemo. My cancer was aggressive. So, um, yeah, so I think hope, determination, family support, even if you don't have a family support, you be the support for yourself,
Yeah.
that's the whole thing.
Excellent. Hats off to you, and thank you so much. I know you wrote this beautiful
Doc,
book.
I just
Yeah.
quickly, I just want to say one thing. Since we spoke about genetic,
Hmm.
um, I don't know if it's true. I wanted to know, but the when my key when my result came positive for my BRCA testing,
Yeah.
my oncologist said, "No wonder you're responding so well to the chemo."
Hmm.
So I asked the doctor. I said, Why did you say that?"
Hmm.
And he said it's because people who are genetically this thing muted
Hmm.
for this thing, they respond very well to chemo. And so they kind of the cancer marker, mine was some 600 or 6,000, I don't remember, but it's shot down to 4
Yeah.
3. So, and that was due to apparently because of BRCA.
So very aggressive cancers, which are generally the kind of cancers that a gene positive patient has, are likely to respond better to chemo. And there are certain special chemo drugs which are made for patients who are gene positive because they act at the
Ah,
root of the problem. So that is why
ah,
patients respond well. Actually,
okay.
I'm. Can you hear me? Yeah.
Yeah.
So I'm so yes, cancers, patients who are gene positive and have aggressive cancers. Not all patients who are gene positive will have aggressive cancers. Some do have non-aggressive cancers also. Like you even mentioned, your bua had stage 0 early breast cancer, which may not
Right.
otherwise be aggressive. But the thing is that aggressive cancers respond well to chemo. And there are certain special chemo drugs which are only given to those who are gene positive because they specifically attack the abnormality in the cells that the gene mutation is causing. So the chances of the chemo working better are higher. And I'm so glad
Okay.
that you honestly spoke about chemo being tough, but you being tougher. And because a lot of times when patients walk into my clinic, they don't want to talk about anything, but they only want to say, I don't want chemo. And I tell them that if it is to make you better, remember all side effects are temporary. So, you are there, a shining example. Look at you. You were talking about chemo having had pulled you down, but you bounced back. So, I was saying, like you wrote this beautiful book, Healed. So, you were not only healed from the cancer, I think you were healed by the cancer. Is that correct if I say it, if I put it that way?
Absolutely. Absolutely. Bang on, Doc. Because I feel cancer came as somehow a strong jolt to me, like a tough taskmasters do, and pulled me out of my hole, the dark hole, you
Yeah,
know.
yeah.
And I'm more joyful today. I'm far more in control of my life. I am much more tougher than I used to be, and much more gentler if and I it's just that I love my life a
Thankful.
lot more.
And thankful for every
And
minute.
I'm, yeah, thankful. I want it to be useful. I want my time on earth, my time living means something, so my focus is always like that. And I'm thankful to cancer, thankful to cancer too. show it to me.
God bless
All
you.
that was, I was just wasting it.
Yeah, no, no. Thank you for saying that. And I hope anybody who's listening to this, who's recently been diagnosed or is going through chemo, can see that there is beautiful light at the end of the tunnel. And we as doctors
Yes.
see so many of our patients actually leading better lives than they lived before a diagnosis of cancer, you know. So just stick in there, be strong. I'm so thankful to you, Manisha ji, for coming on in my series of conversations about getting candid about cancer. God bless you. Thank you so much.
Thank you, Doc. I really applaud all of you for doing such a wonderful job day after day, seeing patient, and um, hats off to you and hats off to all the doctors.
God bless
Thank you.
you. Take care. Bye.